Hey guys, it's Dr. Greg with Judice Sports and Rehab. Back again this Friday doing another video for you guys. As the weather gets a little bit nicer, we call it the fall season, and we're actually going to talk about falls today. So falls are really important to me. We see a ton of them as therapists, and unfortunately there are a lot of injuries that occur because of falls, particularly in the elderly population, but they can happen to anyone. So I wanted to read you guys a few stats from some of the newer research that we've gotten recently this year. So among the elderly, falls are the leading cause of death due to injury. Up to a third of people over 65 fall each year. 40% of elderly admissions to the hospital are a result of a fall, and a hospital length of nearly 12 days. And half of the folks that are discharged from the hospital end up in nursing homes. So that's a huge percentage of people ending up in a facility that they probably didn't want to be in. You know, most people want to live out their later years, in their golden years, in a good situation. And as most people know, as much as nursing homes try to provide the best care possible, they're typically understaffed and not able to provide the quality of care that a lot of those folks deserve and want. So falls are a huge deal, and preventing those falls is a big deal for a physical therapist. So some of the more frequent causes of a fall are weakness, difficulty with balance, vision problems, and coordination. I know the vision one kind of stands out there as not necessarily a physical therapy related item, but it makes a big difference. So try to balance on one leg, see how that goes, and then close your eyes and try to balance on one leg and see how much more difficult it is with your vision affected. So really being able to understand that, you know, having the proper vision for you and your family, working on your strength with a trainer, working on your strength with a therapist, working on your balance with a therapist, and then doing those muscle coordination exercises as well are going to help people prevent that fall. There's also clearing the way of trip hazards. So you've got loose rugs or small pets that typically will put toys in the way, or children that put toys in the way. These are all things you need to at least be aware of. Okay, I'm not saying to get rid of your children or small pets, but just be aware that there are trip hazards in most homes. And if you or a loved one are in a situation where there are more trip hazards than there should be, just try to be cognizant of that and get those out of the way to protect yourself or your loved one from having a fall, because they are so debilitating, especially in the older population. So as a physical therapist, we can help with the prevention side of that. So if you or someone you know is interested in a fall prevention screening, that is something that we do here at Judice Sports and Rehab. We assess their balance, strength, range of motion, assess their gait, assess their ability to do stairs, and see if there are certain motions that they're at risk for injuring with. So we can also provide assistance with getting that person fitted for an assistive device, such as a cane or a walker or crutches if necessary. That's kind of a more post-injury than as an assist as you get older. So just wanted to briefly go into some of the devastation that falls can cause, and you know, I really think it's I think it's important to make sure you're doing something about it and not just saying, oh well, it's just kind of a part of life and people fall in their elderly years and it's just kind of normal. It's not normal, and being able to realize that and seek help before it becomes an issue, because working on your strengthening just a little bit with a physical therapist and your balance and your coordination and getting your eyes checked can make a big difference up front. You might spend a few $100s getting yourself ready for certain challenges throughout the week, but if you fall, the costs are great, both financially and health-wise. So I really encourage you to help yourself, get out there and seek help if you feel like you're someone who's at risk for falls. And most people over 65 are at risk for falls, anybody with balance troubles or anybody that you see doing that side-to-side walking is also someone that we would consider as an at-risk person. So give us a call if you would like to schedule a fall assessment. We'd love to see you guys come in and do that, and that is something we do for free, and we'll make some suggestions at that session. So give us a call, 636-686-0503. Hope to see you guys soon, and I will be back next Friday with another video. Thanks.